Okay, hello, everyone. Thank you so much for joining. We appreciate you coming to join us for our webinar today. We're going to be discussing ELPO, a strategy to assess the risk of injuries resulting from surgical positioning. We all know surgical positioning is very important in the operating room, and we want to talk about how we can help protect our patients. So just a few things to go over really quickly. This webinar is sponsored by Baxter, but the presentation is completely created by our gracious speaker, who I will introduce very shortly. All the lines during the presentation will be muted, but at any point, if you want to add any questions to the chat, you can go ahead and do that. Or also there is a Q&A portion where you can ask questions at the top. We will discuss those questions at the end of the presentation. And here we are going to go into the different objectives. So first, let me introduce our amazing speaker. So here we have Dr. Camila Mendonça, and she is an associate professor at the Federal University of Rio de Janeiro Nursing with a master's degree and a PhD from the University of Sao Paulo and postdoctoral work at the Brazilian Federal Program. She brings extensive expertise in clinical research, biomedical engineering, clinical and surgical nursing, and applied human physiology. And Dr. Mendonça is also a specialist in clinical research from Harvard Medical School. So welcome, Dr. Mendonça. Thank you so much for coming to speak to us today. We appreciate you coming and look forward to getting into the presentation. So before we do that, I'll just go over the objectives really quickly. So we are going to explain the surgical positioning of the patient and its associated risk. We're going to describe the main complications resulting from positioning, discuss the risk factors that influence positioning complications, present ELPO as an evidence-based risk assessment strategy. Also, you will be able to understand how to use ELPO and its possibility of use through the ELPO app, which is a mobile application that you all will have access to, and also explain the steps for developing safe care during surgical positioning of the patient. So we will go ahead and get started. Thank you so much and welcome, Dr. Mendonça. Dr. Mendonça, we can't hear you. Just 1 second, everyone. Some technical difficulties just shortly. Give me 1 second. She's joining us all the way from Brazil, so just give us a second. She's rejoining now.
Hello.
Okay. There we go.
Oh, I am very sorry for this technological
No, we are
problem.
good. So we can go
I
ahead and
didn't
get
hear
started.
your presentation, but thank you for this warm presentation. And sorry for not hearing. So, may I start?
Yes, please do.
Okay, thank you. So, first of all, it is a great honor for me to be here. Thank Baxter for this opportunity. And thank you, everyone here, uh, uh, to give me your time to present my work. I am here to present you the product of my PhD thesis called ELPO and its implication for the perioperative nursing practice. First, to start our presentation, I would like to offer you this rose because it's my favorite flower and that represents all my love for this research, the work of my life. Oops, I am in trouble with this, or are you controlling this, Ashley, or me?
Did you want to see the flower?
Yes, please.
It's on that slide.
Because the slides are changing for me. For you is okay?
The flower is on.
For me, it's another slide, but okay, if you are seeing the flower, for me, oh my God, I don't know why is Oh, okay, let's go. So I would like you that look at this flower and think about a surgical patient. Because a surgical patient, when is positioning to perform a surgical procedure, the surgical patients relies on the team that assists them, such as this rose, so fragile. If we don't correctly perform our care strategies, the patient will be injured, like a rose losing its petals, and it will never be the same. So we need to be this bubble to protect and prevent our patients from developing preventable complications. Could you please change the slide for me, Ashley? Proper patient positioning on the operating table is crucial during surgery to ensure patient safety. Different positioning techniques can provide the surgical team the best possible access to any part of the body that requires surgery. So we can position the patient anyway. Change again. Next, please. However, to perform the correct surgical positioning, we must consider the patient's specificities, which are physiologically tolerated, and balance this with the team's needs for the best performance of the surgical procedure, while minimizing physiological compromising. And the perioperative nurse is responsible for planning and implementing nursing intervention to minimize or prevent possible complications for these patients. Next, please. Complications resulting from patient positioning affect all body systems. Complications may develop in neurological, muscular, vascular, respiratory, visual, and tegumentary systems. These complications can happen due to compression, hyperextension, twisting, or other conditions that impair tissue oxygenation. Next, please. According to the National Pressure Ulcer Advisory Panel in 2019, a pressure injury in a surgical patient is any pressure-related tissue injury that presents non-blank erythema, purple discoloration, or blistering within 48 to 72 hours postoperatively can be associated with the patient positioning. So it is crucial to safeguard our patients and promote clear communication among the perioperative nurse and the postoperative care units. Because if we fail to observe the effectiveness of our intraoperative care strategies without feedback from our patients' destination units, we will never stop this kind of injury from happening. Next, please. Now I want to invite you to analyze these three pictures. This first picture is related to a medical device. Maybe someone forgets something above the patient's head. When you or any professional detects something like this, I am sure you will have more care the next patient. And you will see, oh, look at this patient. There isn't anything above him, so we will double check the next patient. The second injury is related to an electrical returning plate. It is a burn. This is considered a never event, so profound, maybe with legal issues. Many strategies will be implemented in these hospitals to prevent this from happening again, even if these strategies involve costs, such as, for example, buying new equipment, more technology, and more safety. And the third picture shows you a pressure injury related to patient positioning. Most of the time, the professional cannot observe this formation in the immediate postoperative period. And maybe things like this will continue, because if we can't see the injury, we can't prevent the next injury to happen again. Next, please. So we need to ask, who is the patient at risk? Sometimes we consider some factors or some risk factors to judge or to plan the better strategy to protect our patients. But, next please. I would like, again, that you analyze these pictures. Here we have two kinds of patients. And consider you have to choose one of these two patients to judge that one of these two patients has more risk, is in a higher risk situation than the other, for example. And you only have one kind of protection kit to use in just one patient, and you have to choose. So you have just 1 second to choose which one of these two patients you will choose. The first is elderly, have a lot of comorbidities, has fragile skin, and a lot of medical devices. The other is young, healthy, without comorbidities. Have you ever been in a situation where you had to make a decision like this? Who needs more your care? Everyone needs the best care, but who needs more? What will be your decision criteria if you have to decide which patient will use this kit I told you before? In this situation, you probably choose the patient you think is the more fragile, for example. Maybe this elderly patient. But what risk factor for injury development should be considered? Should only intrinsic factors be considered? We need to understand all risk factors. Next, please. According to 2024 edition of AORN Guidelines for Perioperative Practice, Recommendation 6 says, perioperative personnel should identify potential hazards associated with positioning activities and establish safe practices. So instead of guessing the risk, we need to assess the risk and ensure we will choose the best care strategy for each patient. Next, please. This way, you must understand that we have intrinsic and extrinsic factors. Intrinsic factors include age, comorbidities, patient particularities like movement difficulties, for example. The body temperature regulation is very important too, like hypothermia or hyperthermia. And extrinsic factors are also very important. For example, the type of positioning, surgery lasting time, anesthesia, the kind of support surface, because, for example, the support surface can be a care strategy too, but maybe can be a risk factor. For example, in the lithotomy position, you need to use a leg holder. And if this leg holder you choose is hard and narrow, probably this leg holder will cause an injury. Next, please. So, thinking about all these issues, and after completing my master's degree research, more than 15 years ago, please don't have don't do an account. I am young. And this research was related to nursing care during patient positioning. We understand that we miss it. We need an evidence-based tool to guide nurses and to think what will be the best care strategies to guarantee patient safety. And we need to help nurses in making decisions about what patients requires more attention, for example. This way, based on the best evidence and professional expertise that I had before, to correctly assess the risk and guide these care actions, we developed ELPO, that is a risk assessment scale for the development of injuries due to patient positioning. Next, please. So the name ELPO is a name in Portuguese. It's a mnemonic with a mnemonic meaning. E means scale, that is escala in Portuguese, and L means injuries, that is lesões in Portuguese, and PO, the meaning is positioning because it's posicionamento in Portuguese. It's the same in English, okay. PO. So the name ELPO is the name of our risk assessment. Next, please. ELPO has 10 years since my PhD degree presentation. ELPO is made up of 7 items based on evidence. Those are surgical position, duration of surgery, anesthesia, support surface, limb positioning, comorbidities, and patient's age. Each item of ELPO has 5 sub-items, and they were organized based on the best available evidence. So we couldn't change the place of each sub-items because the meaning of this position is based on studies we had before. So to analyze the patient's risk situation, we need to choose one sub-item of each item and sum them. The ELPO scores ranges from 7 to 35. Next, please.
And I saw we had a question, hand raised. If you have a question, feel free to add it into the chat. We'll discuss questions at the end.
Which one do you prefer? Do you prefer that I answer now, or do you prefer?
No, we can wait. We can wait to the end. Yeah.
Okay. So I'll close here. So the validation process for ELPO included, it was a very hard validation, and included phase content validity, concurrent validation, predictive validation, and inter-reader reliability. Next, please. The predictive validation it was most important, is one that checks whether the instrument can predict the future event. And ELPO scale is a predictive scale, so it was the most important validation for us. In this case, we checked whether the patient who was classified as a high risk actually developed some complications related to positioning. For that, we keep it up with the patients until the 4th. Now we know that is until 72 hours after surgery, but when I developed my PhD thesis, we followed the patients until the 4th post-operative day, and we analyzed 2 outcomes, pain and pressure injury related to positioning in all these patients we followed. So in this validation process, we concluded that each extra point in the ELPO score that the patient was classified, the patient's chance of having position-related pain increases by 28%, and the patient's chance of having position-related pressure injuries increases almost 50%, 44%. Next, please. So our journey toward current research began in 2016, when we published our first article of our thesis. And since 2017, with over 45 studies conducted in various contexts for other kind of research groups, ELPO has passed rigorous tests for validity and reliability, carried out throughout Brazil from north to south, with additional validation in other countries. This slide needs to be updated. Now we are in 17 countries, and these studies were carried out in diverse contexts. Over 3,500 patients were analyzed. As a result, the implementation of positioning care protocols that utilize the ELPO score to direct care actions is highly effective. most hospitals have reduced the incidence of injuries related to patient positioning, which is a fact that fills us with so much satisfaction, because is a dream of, I think is a dream of all researchers, that your research is using effectively in a practical way. So next, please. After this rigorous validation process included clinical practice, we conclude that ELPO is a valid and reliable instrument for perioperative practice to assess the risk of developing injuries resulting from patient positioning. Today, ELPO, as I said before, is used in 17 countries and more than 900 hospitals all over Brazil. It is very good for us. Next, please. In this context, you are asking how to use ELPO and how to interpret ELPO. Next, please. To use ELPO, it's quick and easy. We need to choose one sub-item of each item, and the item duration of surgery should be estimated. We need to verify the possibility of implementing special care in patients with a score above 19. And if patient is if the positioning during surgery is changing, we need to reapply ELPO scale. Next, please. Next. Well, we can use ELPO in a paper, or you can use in our ELPO app that I will show you after, and you can include in your digital forms too. So if the score is higher than 19, you need to apply some strategy of care. Next, please. Next. And now, to speed up and facilitate the ELPO's use, we built an ELPO app that is an app to simplify and enhance the process of filling out the ELPO scale, while also providing valuable information to help prevent injuries. And this ELPO is very easy to use. And I want to show you a video, a quick video, just to show how to this ELPO app works. And it's free for download, and I hope that you like this. Next, please. And we can see the video. This is the QR code. Just to, if you want to download, you can scan this QR code and you can download for free. Next. You can. Yes. Now we have a video, a quick video. Let's see. I'm not sure if I can. If I click, you will hear the sound. Maybe it's better if you actually click for me. Thank you. You can play the video.
It's free.
It's free. I can't see the video playing, but it's okay. Everyone saw the video with sound and everything was okay for you? Because for me, it didn't play, but it is okay. So next, please. I think it's frozen. Okay, now. So the last screen, one before the last screen of ELPO app. The ELPO app will show the ELPO score of the patient you are analyzing. And if you click in the care recommendation button, you can see a screen. Next, please. I think will be the next. Okay. No, you can go back for an instant. Sorry about that. So if you click in this care recommendation button, you see the positioning type that you choose. And it's important to say that in the ELPO scale, if you pay attention before, we don't have all kinds of positioning, but we have the three most important, that is supine, lateral, and prone positioning. So if the patient is positioning in a situation different that you can see in the ELPO scale, you choose the original position from the term. For example, sitting position, it's related to supine position with some modification in the body, okay? So you click in supine, and you see in the last part, the patient will be in supine, but we will have a button. You can see some variations. You can click, and the sitting position recommendation will be there, okay? So our intention with this app is not to be like a calculator, just a calculator. And we want to give everybody a care recommendation based on evidence, and every hospital, every nurse can do a care protocol specific for their institutions, okay? So next, please. Now I will show you a clinical case to exemplify the use of ELPO scale, but maybe we can show using ELPO app, but you can do this with the ELPO scale in paper too. But I highly recommend that you use ELPO app. So in this example, in this case, I will show you the patient is 71 years old, and this patient has obesity and diabetes. He will undergo a left nephrectomy, so the position will be lateral. The estimated duration of this surgery will be around 5 hours. The type of the anesthesia will be general. The patient will be on the operating table with a foam mattress and some viscoelastic devices already on the operating table. The legs will be open and bent. So in this situation, we will use, could you please play this first video, this in the middle of the screen, please?
It's playing.
And
going through the different screens, putting in the 5 hours, now showing its general anesthesia, just showing how you click through the different pages.
Mm-hmm. And we are choosing exactly the things I told you before, just to see the sum of the score at the end.
Comorbidities, patient's age, and the score of 23, high risk.
Okay, in this situation, the patient's ELPO score is of 23, indicates a high risk of developing complication related to, I'm sorry about that. My phone is ringing my computer. So the score 23 indicates a high risk of developing complication related to patient position during this surgery. And if we click in this care recommendation button, so you can press just one, just to see if it will appear the positioning that will be lateral. I think these slides for me is showing different. Sorry,
it did choose that. Lateral. Do you want me to play the next video?
No, not the next video. If you because we have an image of the lateral position in this.
Oh.
Top part of the slide. Oh, it's not showing. Okay, you can go back. Okay.
Oh, I see what you're saying.
Okay. So
there we go.
Now it's okay. Okay. In these plus buttons, you can click and you can see our recommendations for each part of the body. And if you click in the special care, our app combine all the information that you click before. For example, if we click it, that patient has obesity. So in this lateral position, we have some recommendations for this specific patient that has obesity, okay? So in this special care is related with your patient, the patient you are analyzing right now. These clinical guidelines that you can see button, you can click and you will see all care recommendations, global recommendations, and this position changes. You can see some change in this kind of positioning, some recommendations for patient that is in a little bit different position that considering lateral positioning. So just to show you how all these buttons works. And in the next video, you can
It's sideways, but
yes.
it's playing it, but it's showing the sideways view, but it's showing you see the different care recommendations, right?
Yes, yes.
Mhm.
And this patient, maybe before, even if you don't use the ELPO app, you will think maybe this patient will be in a higher risk situation because he is 71 years old, with obesity and diabetes. So maybe you think you need to protect this patient. But let's see cases to the two. Next, please.
Case study 2. 1 second.
So in this case, we have a young woman, just 40 years old, apparently without any significant problem. She has diabetes, but is controlled. But one day, she had an acute myocardial infarction. Oh my God. And she needs to go coronary surgery with artery bypass, for example, with saphenous bypass. So in this case, the positioning will be supine. The surgery estimated duration will be around 7 hours due to the 2 operating sites. And the anesthesia will be general. The patient will be on the operating table with a foam mattress and cushions made of cotton. The position of the limbs will be anatomical, and the arms will be beside the body. And in this particular case, let's see how will be the evaluation of the risk.
Going through the slides, choosing supine.
Yes, 7 hours. General anesthesia. And this is conventional foam mattress and viscoelastic. Here we click on deep vein thrombosis because she had an infection, myocardial infarction. Okay. And in this case, the score is 22. So means that this patient is in a higher risk situation, is in a high risk of developing complications related to patient positioning. So even if this patient is young, without special comorbidities, even maybe appears that she is in a lower risk situation, with this mathematical analysis, we can show that this patient is in a high risk situation. So we need to use an evidence-based risk assessment based on evidence, mathematical, to really assess the risk, okay? And here, if you click recommendation care, you can see the supine position, this care recommendation button. And in the special care, you will see the same, the recommendation of the ELPO app combined the items that you clicked before, so you can apply some, maybe some devices or some protections. Even if include costs, you can justify this cost because this patient is in a higher risk situation. And your care protocol can consider this score to indicate this. So with these two cases, hope that you understand how easy it is to analyze the ELPO score of each patient and the recommendation of care for each one. Next, please. So this ELPO app was designed by Brazilian nurses with a lot of care, a lot of love to ensure patient safety and to speed up this process of evaluating our risk situation of our patient. Next, please. Oh, this was the slide. I changed the slide, I think. So just to say that here in Brazil, it's very difficult to develop some researches. We need to go forward with our own power. But it's a great pleasure for me to be here to present this for you. And it was a long journey to arrive here, and I hope this event that is very important to me help me to disseminate this tool in USA. Next, please. Here, just to show our history. Next, please. And now, just to end this session, I would like to give you some quick tips to how to successfully implement ELPO. Next, please. First, we would like to show our professionals inside the operating room, the theoretical evidence, and we want to encourage a safety culture. These tips I am showing you, we did a protocol of training here in Brazil. I presented this protocol in your conference this year, and I was granted with the first place. It was very good for us. And this kind of training that I am doing, these quick tips, we replicate in every hospital that beginning to use ELPO here. So first is very important to understand the theoretical evidence. And in Portuguese, we say that we plant some bug below earth, you know, like you are thinking about it every time. I don't know if the meaning is the same in English.
Similar. Yes, similar.
Okay, next, please. So after this, we show the best practices to help them to elaborate care protocols and implement these best practices in their practical settings. Next, please. We involve the whole team. We understand that it's very important to involve everyone inside the operating room. Nurses, anesthesiologists, surgeons, technicians, everybody. Next, please. Every time we show how to use the support surfaces they have, and we teach how to select the correct support surface for each patient. Next, please. We remember the importance to communicate because we need the feedback from our care units that receive our surgical patients. Next, please. And we training a lot. This is a picture of the theoretical part of our training. Here in this picture, you can see a lot of kinds of professionals mixed. Next, please. And this video, I love this video. I will play this video with authorization of the hospital I film this, I record this. And in this quick video, I would like to explain first, you can't hear anything because everybody is very quiet. And here, all professionals are very really taking care of this patient, because everybody wants to make sure that the patient's position will guarantee patient safety. So in this video, you can't say who is the anesthetist, who is the technician, who is the nurse. But here we have students, we have professors, we have residents, we have everybody doing their best. You can play the video, please. It's very quick.
Here we go.
So you could see that they turn the patient, but everybody is doing their best to achieve their best to guarantee patient safety. So next, please. So with this presentation, I would like to show you how patient position can be higher risk situation for everybody. And I would like to guarantee that you be the dome for your patients. I hope you use ELPO Scale, you download and use ELPO app. And thank you again for this opportunity, Baxter and Ashley, because you are my main communication persons. And I know language is a challenge. I know I have a hard accent, but I hope that you understand my presentation. I try to do my best. And thank you very much. Even if this technological thing that it actually needs to to turn the slides for me. And next, please, Ashley. And here you can scan to contact me. I will feel very happy if I can answer your questions now.